We're live. Welcome, everybody. We're going to be starting in about three minutes.
Good morning, everyone. We saw the question about how long the meeting is, and this meeting, which we will start in just a second, will go until 11 a.m. So 90 minutes from 9:30 to 11. And once again, welcome. And I think, Chloe, you can go ahead and get us started.
Okay. Hey, everyone. I am so excited to be kicking this off today. I head up food and agriculture coverage at Forbes, and we're going to be discussing how New York City made it through the pandemic and what really are the takeaways here. There's so much to dig into, and I'm really just going to start by introducing the flow of this event and introduce our panelists. So we're going to basically be discussing a hindsight 2020 food report that will be coming out later this week. There was an amazing op-ed in the Daily News today. I think everyone should check it out, and we'll be posting the link, I think, as well. And then we're going to go into a discussion, and as we're having this discussion, please think of questions. We're going to have a bunch of time reserved at the end for some Q&A. So without further ado, I'd love to introduce our panelists. Charles Platkin is the Executive Director of Hunter College's New York City Food Policy Center, and he's a distinguished lecturer as well. Pamela Koch is the Executive Director and Associate Research Professor at Laurie M. Tisch Center for Food Education Policy at Teachers College. And Nicholas Freudenberg is a Distinguished Professor and Director at CUNY Urban Food Policy Institute at the CUNY School of Public Health. There's so much to dig into. I know the report will be public soon, but can you give us an overview of why this project is so important and some of the key findings from the report that you can share?
Sure. So first of all, once again, welcome everyone, and thank you so much for attending. And before we get started into why we did this and the key findings, I want to thank our funders, because this would not have been possible without our funders who rose up right at the beginning of the pandemic to see the importance of this project. So in alphabetical order, the funders for this project are the Community Food Funders of North Star Foundation that also did all the coordinating, the Laurie M. Tisch Illumination Fund, the Lily Auchincloss Foundation, the Merck Family Fund, New York State Health Foundation, Shacker Foundation, and the Pierre and Tana Maltese Foundation. So once again, we thank all of our funders who made this possible. And on behalf of Charles, Nick, and I, and all of our teams, we are really excited to be working on this project together and having this event. And once again, want to thank all of you for attending. When COVID-19 was spreading in New York City and the rates of infection were going up so quickly and hospitals were overwhelmed, there was also increased food insecurity, limited access to food pantries, questions about how school meals were going to feed the 1.1 million school children that depended on them, retail changed, and restaurants were shuttered. There was a swift and massive response from government, anti-hunger, and nonprofit organizations, as well as food businesses. Yet, we all talked to each other and we realized that without an evaluation and a deep dive into this, we would be missing valuable lessons for New York City to be better prepared for future crises. And we realized that with the three of our centers working together, we would have a wider range of skills and capacity to be able to collect and analyze data than any of us would have on our own. So we are so delighted to be working together. And I'm just going to share 3 top key findings and recommendations from what we have done so far. First is that food-related policies and programs were inadequate for the challenge and scale that COVID-19 presented to New York City. So on a city level, we recommend strengthening the Mayor's Office of Food Policy by passing legislation that codifies this office and expands this office. And on a state and federal level, we recommend a really unified voice coming from New York City for anti-hunger and nutrition policies. The second key finding is there was a lot of tensions between getting New York City residents enough to eat at the same time as getting them the right foods. Even with New York City's strong food standards and the public's awakening of the threats of diet-related diseases, that challenge was hard. So we recommend supporting healthy, affordable, and culturally relevant diets by monitoring retail food, institutional food, and emergency food for the impact that they have on diet quality, and to address the inequities by income and race, and continue to invest in the Get the Good Stuff program. The third finding and recommendation is that food insecurity is high and remains persistent, and will, as this public health crisis and the economic crisis that's related to it are going to be lasting. And that there are specific groups that are particularly vulnerable: immigrants, small food business owners, food workers, and children, especially those who rely on school meals for the bulk of what they eat. Lack of coordination and communication about available food-related resources slowed and stymied the food distribution efforts, even as they were being started. So we recommend creating and maintaining a public and living database. This would be for emergency food providers to be able to update users on openings, closings, and hours, and a database that can track food pantry inventory so that food banks, community organizations, and the city can be helping to fill low inventory and make sure that those high needs that they have are continued to be met.
Is such a huge effort, and one of my favorite things about this report is that these recommendations are so specific and are so actionable. And I just want to pull out a stat from the report. Through the pandemic, the number of food insecure in New York City has doubled to 2 million in the city, which is a huge amount of people, and that's why these recommendations are so important. And obviously, you know, each of your organizations has been working for a long time to address the deeply rooted problems and causes of food insecurity in New York City. But I'd love to hear more about how you chose to design the methods of this project and how your organizations worked more closely together.
Sure. First of all, thanks to all of you for participating in this, and especially to my colleagues at Teachers College and Hunter College and the CUNY Urban Food Policy Institute. This is really a collective effort. As you said, Chloe, each of our organizations has been working for some time to address the really deep problems of the food system in New York, including high rates of food insecurity. You mentioned that 2 million figure, but we also need to remember 1.2 million people were food insecure before the pandemic. A retail system that offers ample healthy food in some neighborhoods, but mostly unhealthy food in other neighborhoods, primarily Black and Latinx and immigrant neighborhoods. A diet that contributes to huge burdens of chronic diseases, a food labor force that is underpaid and exposed to unsafe conditions, and a food governance system that excludes ordinary New Yorkers from making decisions about the policies that shape our food choices. Those were the problems that led us to decide to work together. And as we watched the COVID-19 pandemic unfold in our city, all of us working in our 3 organizations had a deep sense of dread. Dread because we feared that the pandemic would undermine some of the progress that New York City had been making over the last decade, that our organizations had been important in documenting and advocating for. And also, there was dread because the pandemic was making it so much harder for so many New Yorkers to get the food they needed. But we also felt some hope because we thought this crisis presented an opportunity to finally address seriously some of these food problems facing our city. And hope because we were inspired by the determined efforts of essential workers, ordinary New Yorkers, many city officials, and the hundreds of community organizations in our city to work together to feed and take care of our city during this crisis. That really inspired us to dig in. And our hope in this report is to provide the evidence that the city officials, advocates, and community organizations will need to ensure that we use the pandemic to build back better our food system here in New York City, to achieve our potential as the wealthiest city in the world, to find a way to make adequate, healthy food a basic human right in this city, and to ensure that all food workers have adequate pay, benefits, and safe working conditions. And finally, that we can make hunger history in this city. We understand these are ambitious goals, but we believe the unprecedented crisis provides New York City with the opportunity to get serious. So you asked, how did we complete this report? Each of our organizations had already been studying the city's response to COVID. Folks at Hunter were assessing community-level responses to growing food insecurity. At Teachers College, my colleagues were investigating how the school system was adapting to the pandemic. And we were looking at the food workforce and some of the systemic issues. And so in order to put together this report, we interviewed frontline community workers, city staff. We reviewed, I think, hundreds of public reports, city council hearing transcripts, and media accounts. And we were determined to get the perspectives of a wide variety of stakeholders so that we could put together what we believe is the first comprehensive, independent look at the city's response to COVID. So that's how we did this.
It was such a major effort, and I'm really glad that you brought in, how New York City can really lead here. I think that's what really should be the takeaway. This report and these recommendations can really set a path forward that can, my hope, it really changed how we think about food insecurity and nutrition in this country moving on. And so I want to ask the next question. There is so much interesting and positive work being done throughout the city through the darkest days of the pandemic. I live in Chinatown, and I haven't left through the whole time. And what was really keeping me going was the neighborhood groups that were cleaning, neighborhood watches that were cleaning off the trash cans handles, and neighborhood groups that we would be putting together packages of scallions and cabbage for elderly that, were essentially left behind and weren't able to go to grocery stores and needed to get food. And I want to talk about what were some of the most positive changes that you guys have been seeing happening, through these dark times, and also what were some of the challenges that maybe you haven't seen some of the work be as effective yet?
Sure, I'll talk about that. And what I want to reiterate, and I think is the major theme that Nick just talked about and Chloe just talked about too, is that there was a lot of despair and a lot of challenge, but there's a lot of hope because there has been so much elevated concern about food insecurity and how our food system works and change. And so we have to all keep that close. So to start with the successes, the city established a unified and central response. What? I'm sorry. Yeah. So incredibly important to remain hopeful.
Yeah, no, I've been so inspired by the community fridges and the community groups that have been, giving out produce on our corners, honestly. But we're a little late, so keep going.
Yeah, no, of course. And you're right. And we have to think of the small and the large things that we have to be hopeful for. So one of the large things was that the city actually coordinated a food czar team that was led by Catherine Garcia and also included Kate McKenzie, who is the director of the Mayor's Office of Food Policy. And this team right away laid out an inclusive, expansive, and much needed plan called Feeding New York that included how residents could get grab and go breakfast and lunches from schools in all communities across the cities, groceries from food pantries, and prepared meals for seniors and those that were medically vulnerable through a brand new program that was started called Get Food New York. And this ensured that people got the food that they needed. Get Food New York has served to date over 120 million meals. The New York City Department of Education's Office of Food and Nutrition Services was one of the first agencies that radically overhauled what they did just about immediately when schools closed, which was on a Sunday night, to serve both children and adults from the very beginning of the shutdown. And they did this with open doors, no IDs required, and had the communication about what they had in 11 languages. By June, they were operating in over 500 sites that ran across the city, and they were serving 550,000 meals a day, and they were offering vegetarian, halal, and kosher options. So that was all what was great. There were some misses and things that I think we could do that could be improved upon. First of all, the early implementation of Feeding New York at times was rocky and inconsistent, and that was indicated by the low number of initial meals that were served, and that there was a high volume of complaints that were coming out in the press, as well as on the weekly advocacy calls that the Food Czar team hosted. So it was a rocky start. It was a huge effort and a rocky start. And while the DOE meal service is impressive, what they were able to do, that's far less than the 950,000 meals a day that are normally served when children are in school. So there was a lot of need that was not being met. The implementation of Get Food New York utilized new food providers because it was a program that was just getting started. And there was a lot of challenges, and seniors needed to register online, which was really difficult. So while they mobilized quickly to fill this tremendous gap in getting meals out and people didn't go hungry, there was really more of a need for coordination and a need to really look at the nutritional quality of the foods that was being served. And again, I want to say that this highlights why for the future, we really need a strong Office of Food Policy that can have plans in place that can address future crises.
Yeah, so I mean, going off of that, I mean, was there really a need for a food czar to begin with? And do you think her role was, accurately met?
Good morning, everyone, and thanks for coming, and thanks to the two centers. I'll answer that. I think there was a need, and I think that the reason that why there was a need was because of what Pam was talking about earlier, is that the director of Mayor's Office of Food Policy didn't have enough power to coordinate the efforts that were needed in such a crisis, right? So the mayor tapped into his go-to person, which was Commissioner Garcia, and she was overseeing and was still during this in parallel tracks overseeing the sanitation department, which is one of the largest in the world. She had 3 other titles also: vice chair of the New York City Housing Authority's board, lead czar. She was the lead czar component there, and most recently she was then promoted to the COVID-19 food czar. And by the way, I think we can all agree that food czar is not the best name, and that was the actual name that was given to her by the mayor's office. We all, I think, could be in agreement, including probably all the attendees, that wasn't the best choice of terms. But I think it was great that she was able to quickly cut through all of the red tape, which was just incredible and needed. And all, the amount of effort and work that was done in such a short period of time probably would have taken years under normal circumstances. And she was able to quickly, because of all of her relationships throughout all different agencies, just cross-cut all of that, and probably because of her reputation that she had within the political community. She used all of that authority, power, and goodwill to cross-cut everything. She was not an expert in this area. And she didn't cut out Kate McKenzie. She took her in and, just worked side by side with her, which from this end looked like no ego, which I think was impressive. I don't know what went behind the curtains and what was going on, but it was truly impressive for the way it was coordinated, and that, Kate McKenzie wasn't cut out, who was the current director of the Mayor's Office of Food Policy. So I have to say, hats off to the city, to Kate. They answered questions. They didn't close their doors. They were responsive to needs. And I think all those things, were really fantastic. And especially the cross-cutting of city agencies, and, the lack of duplication and the mobilization was because of real cooperation, real caring and concern. So yes, there was a food czar needed, but there shouldn't have been a food czar needed.
I think that's a great point to take away from that. The pandemic has had such a significant impact on food workers, from delivery workers to grocery workers to restaurant workers and beyond manufacturing. What did you learn about its impact on this labor force?
Well, for the most part, I think the pandemic has been a disaster for the city's food workforce. By July 2020, the overall unemployment rate for New York City was 19.8%, 5 times higher than the rate in July 2019. New York City lost a total of 646,000 private sector jobs, the largest number in the food and hospitality sector. The number and proportion of overall private sector jobs lost between January and July 2020 far exceeded the losses in previous recessions, including in 2008. So a lot of people lost jobs. And today, as in the past, Black and Latinx, immigrant, and women workers lost jobs at higher rate than white workers, in part because these populations are concentrated in the food industry. New York City restaurant spending dropped by more than 90% in late March compared to the previous year. And experts predicted that the decline in restaurant spending will cost the city more than $1 billion in lost sales tax revenue, hurting all the city efforts to help people. The working environment of most food workers exposes them and then their families to the risk of interactions with clients, customers, co-workers, along with the risks of using public transportation. Food workers can't work at home. So of the 1,860 people who work at the Hunts Point Terminal Produce Market, 52 workers tested positive for the virus by April 21st, a much higher percentage than among the general population as of that date. And yet no food business in Hunts Point closed due to COVID-19. And those experiences were repeated in food stores. People of color who work in the food sector are less likely to work in jobs that shield them from these risks. But I think the final, more hopeful point that the pandemic is it also generated a new respect for food workers. More of us recognize them as essential workers, vital to the task of being able to get food and feed our families. And in the coming years, we'll need to find ways to translate that deserved respect into better wages, decent benefits, and sick leave is a particularly important one for food workers, and safe working conditions, and better opportunities for advancement. The food sector is a really major contributor to the wide gap in incomes in this city.
I couldn't agree more. I think this pandemic has really made a lot of Americans really understand what has to happen to make their food get to their plates, and why the prices are what they are, and how things maybe need to be, I think, more evened out. I'd love to talk more and dig into this concept of this comprehensive database. We've been getting actually a fair amount of questions already on the Q&A about it, and so I know we wanted to talk more about it. Let's dig into who you guys spoke with to come up with this idea, and what you really hope could come of it.
So I'll talk to that. So there was a lack of any centralized or comprehensive information of community food resources, which is so important. This connection of what's available in your community, and what the hours are, the openings, closings, and so forth. So at the suggestion of the city council and community-based organizations, the Hunter College Food Policy Center and many of its strategic partners, including Hunger Free America, Share Meals, and City Harvest and Plentiful, we developed 59 online New York City neighborhood food resource guides. And each of the 59 guides included updated information on all food pantries, soup kitchens, meals for students, meals for seniors, delivery services, as well as many other important food resources. And the guides are updated daily, and there were more than 32,000 volunteer calls so far updating this information over the last few months. And additionally, they're updated every night by information coming in from City Harvest, Plentiful, the Food Bank of New York City, and New York City itself. But I think that and by the way, the information is at New York City nycfoodpolicy.org/food. But I think the key point here is not that we did them and they're so wonderful, all right? That's not the point at all. The point is that we really don't think we should have been doing them. And we don't think we should be doing them going forward. We're happy to, and there's a need. But I think the key point is that, number one, this is something that we think the city should do, or the city should designate someone to do it, not be sort of an ad hoc kind of thing. And again, not to come down hard on the city, because I think they had a lot of moving parts going on, and it was really difficult to do anything. My, not criticism, but sort of recommendation is that this should have been thought of previously, and it wasn't. But now we've had this opportunity, which is why these three centers got together to create this report, to be able to come up and say, hey, let's take a breath and let's look at what we could have been doing. We didn't do it. Okay, we're not going to beat ourselves up about that. We're going to see how we can now improve. And we're still updating these guides. And at some point, it would be nice if there was a relationship with the city of New York, and that's how they were updated, with every possible information that could be provided to its residents. And additionally, I think it's not enough that these just sit on a website, right? Because even though people have smartphones and have access to the web in many instances, especially in underserved communities, there should be the ability to have text updates. They should be postering around every different community with different resources that are available, maybe not the hours of operation, because those have been changing so frequently. And, I'll talk about this a little later about that more than 30% of food pantries were closed, and disproportionately in underserved communities, and hours of operations were changing. But it would be really important to have all of these resources connected and in the faces of the community members that need them most. Look, we developed this Link NYC system. Okay, and all the data that we have, meaning food pantry openings and closings, soup kitchens, supermarkets, whether they deliver, take SNAP or WIC or anything, all of those things have longitude and latitude connected to them. So you could easily and technologically have every Link New York City, NYC, those are those kiosks that you see in and around the city, that was very expensive and could potentially, and they have billboards on the side of them, with a click of a button, and maybe I'm exaggerating, within a 3-block radius, every one of those Link NYCs could have openings and closings of food pantries and soup kitchens and opening hours, okay? So there should be an app that's developed. I know that Share Meals had developed something along those lines, but it should be a city app where people can get updates according to their community in real time of food inventories, which I'll talk about a little bit later, what's available, making an appointment like with the Plentiful app, and all those things need to be connected and should be on one of the highest priorities in New York City, because oftentimes fortunes are spent on resources that are excellent, but then not taken fully advantage of, or only some people in the know get that food and others don't. And we want to eradicate that imbalance.
If I can just add one point here, I think all those suggestions, Charles, of improving our emergency food program are really important. But I think something else we've talked a lot about is that it isn't right that our solution to high rates of food insecurity should be these charitable programs. In the long run, the response has to be to make access to healthy, available food a basic right. And that's why it's also important to expand SNAP, to make more people eligible for SNAP, to make it easier to enroll in SNAP. These are two parts of the solution to food insecurity: improving our food security system, our emergency program for the short term, but in the long run, ensuring that New Yorkers earn enough and are able to afford healthy food to support themselves. And that is the big challenge facing New York City. The food security assistance is important, but the long run solution is making sure that every family has enough to be able to get the food they need.
Thanks, Nick. And I just wanted to add one thing to that, and we'll talk about it a little bit later, but I think that Joel, I was reading in the Times and know Joel Berg really well, but one of the things he pointed out, which struck with me and will stick with me forever along Nick's lines, is that, charity is one thing, but just the PEBT, and not to take any thunder away, but the $880 million that was provided to New York City, I think I got that right, to Joel Berg's point, was specifically that dwarfs any kind of charitable contribution, meaning the government has so much responsibility in eradicating food insecurity. And that's a great point. Thank you, Nick.
Yeah, this has been great. So I want to switch the gears a little bit to talk about diet and nutrition, because there's been so much discussion around what you eat and how it impacts your potential COVID-19 outcome. So I'd love to start there. What was the profile of food that was distributed by cities' agencies, and what have we learned about nutrition and diet and long-term health?
Sure, I'll talk about that. And first, just to say, because I think it's related to diet quality, is the 880 million, and yes, Charles, you did get that number right, was really a way to give families resources to be able to afford higher quality food. And it was at a time when our city really needed that, and still needs that economic influx into our stores, into our families, into the economy. And so it's actually great. And Joel is exactly right, is that is a huge infusion into our system, much bigger than could be done by charity. So we celebrate that. And, when you get money from the federal government in a tax return, of course you're going to use it. So we think every family should use this funding. And maybe we can talk more about that later. But to get back to diet quality is, as we talked about before, the COVID-19 crisis made it so much more apparent how important the danger of diet-related chronic diseases are, and the disparities that we have in different neighborhoods. The NYC DOE, the school meals that we talked about before, they could have applied for a waiver to take out some of the meal components, and they didn't. And they met the New York City food standards as well. Now, there was also a lot of repetition, particularly for people that were getting the vegetarian, kosher, and halal meals. So that may have affected things. And Get Food New York really tried to meet the standard because it was such a new program and it was so big. Diet quality was sometimes compromised in order to get people food, which is why going forward, we need to track this a lot more and realize the importance of focusing on diet quality at the same time that we're focused on getting people food, and better understand the nutritional content of all the meals that we are serving through our agency's meals.
So what ways has the pandemic contributed to pre-existing health inequalities that obviously have been so prevalent in New York City for years?
So in my view, the pandemic has provided a wake-up call to New York and the nation, really, that if we persist in supporting a food system that makes unhealthy food produced by giant corporations more available, more affordable, and more heavily marketed in low-income, Black, Latinx, and immigrant communities, we will continue to reap the burden of pain and suffering, premature death, and preventable illnesses that the diet favored by big food companies imposes on our city's people, our healthcare system, and our taxpayers. And the diet-related diseases, including, as new evidence shows, COVID-19 itself, which is people with diet-related problems are more vulnerable both to getting COVID and to having worse outcomes. Those diet-related diseases are the leading cause of health inequities in New York City, and the stark differences in death and illness rates between Blacks, whites, Latinx, and Asian New Yorkers. Through our agricultural subsidies, our failure to enforce antitrust laws, and our unwillingness to regulate predatory marketing of unhealthy food, especially in low-income communities, we have allowed this unhealthy diet to become what is most available and affordable, especially in low-income communities. The pandemic illustrates the high costs of food apartheid, separate food systems for the better off and the poor. And as Charles, Pam, and I wrote in an op-ed in today's Daily News, as the next wave of the pandemic looms, New York City could make a lasting commitment to the health of the city in the future by using the lessons from COVID-19 to dismantle this food apartheid, which leaves so many New Yorkers without access to the food they need to stay healthy. That's the opportunity.
Yes, yes. Okay, so let's talk about how to do that more. So one of the recommendations is about updating food inventories. Can you talk more about what that would look like?
So, this is something that, again, I'm not a technological expert, but my instinct tells me that, and I know that, food pantries don't necessarily have the technological capabilities. Some of them are in a basement, in a church, with 2 or 3 volunteers. But I do think, and again, maybe this is pie in the sky, but that there's an opportunity here. Plentiful is an app that was a joint effort of many different organizations, including the City of New York. Now it's, I believe it's housed at City Harvest, but I think it's still a joint effort. Correct me if I'm not getting that accurate. But Plentiful, what they do is they allow for people to make a reservation at a food pantry, which I think is very exciting, and the work that he's doing is great. But he only has, I think, about a third. This is Brian and the group at Plentiful. Only has about a third of those pantries signed up. And again, a lot of these pantries are mom and pop organizations and not well funded and so forth. But I think that there's an opportunity, given this emergency, maybe, not a silver lining, I don't even like to call it that, but just an opportunity from lessons learned, that potentially, if there were real-time inventories that were tracked in some of these food pantries, that we would be able to make sure that they were stocked well enough, because a lot of them were running out of food from our findings, and a lot of it don't have the potentially the nutrition quality. We just heard about food quality and diet, don't have the food quality that would help to rise up and improve their lives. I think this is an opportunity for us. So for the city to evaluate and see if this technology that can be implemented. For instance, most people have smartphones, many, and Pew Research shows that, even in underserved communities. Potentially, the city could give smartphones to any pantry, and simple ways for them to update their inventories. Again, I don't know enough to be able to speak fluently and properly about all this, but I just would like those listening to think along those lines. Think about using technology as a way of solving some of these issues. It's terrible that some food pantries had to close in underserved communities. And as my colleague Nick has pointed out to me in the very beginning, which maybe he doesn't remember, but I'll remember it for a long time, is that when a food pantry closes in a small underserved community, even though it's a small food pantry, it may be the place that the people that were going to that food pantry feel so connected to and feel comfortable with it. Maybe they're undocumented workers. And the fact that that food pantry closed because they couldn't get food, or because their inventories were low and nobody knew because they couldn't reach anybody, that's not good, okay? So even though some people dismissed the 30% or 40%, or some of the numbers are even higher, 50% of food pantry closings, as others would have taken charge, this does not necessarily mean that we should not be considerate and thoughtful around these areas.
Thank you so much. I'm gonna end this panel there. We'll take that as a little takeaway, and we're going to have a brief new panel where we're going to introduce some amazing panelists who have had the opportunity to review the draft of this proposal report ahead of its publication. So I'd love to introduce them, and we'll ask them some questions about it. They've really been in the front lines of food insecurity issues through the pandemic since March, and for so much longer too. But without further ado, I'd love to introduce Dr. Melony Samuels, who is the executive director and founder of the Campaign Against Hunger. It has made several adjustments to their programming to reduce the risks brought on by COVID, especially for their most vulnerable clients. They have greatly expanded their footprint during the pandemic through a partnership with Broadway Stages and Early Street Rooftop Farm. And the organization has been given an actual expansive warehouse, which is amazing, to use as a food hub. This allowed them to be able to double their annual capacity in just a few months. And then next we have Charmaine Ruddock, who is the product director of Bronx Health Reach at the Institute for Family Health. She oversees the community-based prevention initiatives and the public policy efforts at Bronx Health Reach, which is whose goal is to eliminate racial and ethnic disparities in health outcomes in diabetes and health disease in African American and Latino communities in Southwest Bronx. Bronx Health Reach has kept their work growing stronger than ever during the pandemic. These are two truly inspiring leaders. Thank you so much for joining us.
Thank you for having us.
So I'd love to just start. You got a chance to read the report. Can you tell us what's been consistent with your experience since March and what you overall kind of thought about it?
Sure. Do you want me to start?
Either. All good. Hop in.
Sure. So first, thank you for having me. And I want to start off by first applauding the authors of this study and this report. I think I was particularly thrilled with the fact of its immediacy, its timeliness. Given what we have been going through during the pandemic, I think it was critical that such a report did not come a year or so after, but sought to understand what has been happening now and make some recommendations. The pandemic represented a disaster of historic proportions, not just in terms of the impact of the cases and the death from the virus, but it was a disaster for a very fragile food system, particularly as we experience it in the Bronx. For too many, food insecurity is basically a chronic condition. And for too many, food pantries and food kitchens, which are supposed to be emergency suppliers of food, and I apologize, I don't know why. It's my luck that the garbage truck has decided to pass by just when I needed to not be on mute. So I apologize for that. But those food pantries and those soup kitchens that are supposed to be addressing emergency food needs, right? For too many in the Bronx, for too many Bronxites, those are their usual and customary sources of food. So we hear, and I totally subscribe to the notion that the pandemic laid bare many of the disparities happening in communities like the Bronx. One of the things that this report points to is the pandemic of food insecurity. About 10 years ago, a report was released and the New York Times carried it about the double crisis of obesity and hunger in the Bronx. In the decade that has passed, that has not changed. And so this report captured much of our experience in the Bronx as many of the Bronxites were experiencing the food insecurity on a much more dangerous level, but also that the places that they went to food was very much threatened, right? So a number of our food pantries closed. A number of them closed because they couldn't get enough food to meet the demand, and because they did not have the necessary PPE to serve people. So those were some real challenges that we experienced. I also was particularly taken with the fact that not only did the report capture the issues of access, the issue of quality. I was particularly pleased that it captured the issue of information dissemination, because that is something we really experienced when in the schools that we serve in 4 school districts in the Bronx, they were not getting information. And so they looked to us through our e-newsletter, through Zoom meetings, telephone calls that we had to disseminate information very, very, very broadly to the community. So I'll stop there, but as somebody who has been sort of fixated in what's happening in the Bronx, and I don't understand why, for most of us, our work got so much more, working away from the office, working remotely. And so you are not able to sort of, reading the New York Times has become a luxury that I no longer have. But what I particularly liked about the report was a wide lens it offered, like somebody like me, of what was happening in the food landscape in New York City, not just in the areas that we were particularly working to address in the Bronx through Bronx Outreach.
Thank you so much for those comments. Wow. Melony, did you have any feedback on the report, or was there anything that it missed that you wanted to share? And in general, we'd love to just hear more about how your organization has been dealing with the pandemic and what it's been doing to address all this new demand.
Hi, everyone. Thank you for the opportunity to share. First, I must say about the report that was submitted, it really amplified the truth, and that's what it is. When I read it, I was like, they actually did in detail research, and you guys spoke to the right people, because what you wrote is exactly what is happening. And it has also brought attention to the food insecurity, what's going on in our pantries, which is, it's heartrending, but it's the truth anyhow. I appreciate Nick talking about the fact that the living wages, or how impact SNAP is. It is to me that a lot of what you have written have come to surface, and I'm hoping that when it's released, that it will bring attention to what's needed to be done. I believe the system can be fixed. The fact that so many families are going without, especially in our Black and Brown community, and as we have looked at how COVID-19 has impacted us, you did bring it out, is that pre-COVID-19, we had 1.2 million insecure families, food insecure families. It was there, but it was swept under the rug. It was hunger hidden in plain sight. It was not a new thing, but we have talked about it so many times. There have been policies over policies, but I think what COVID-19 did for us, it's a sad thing, but it brought everything to reality. The first thing we saw was that many pantries that are run, particularly by seniors, were closed. A little over a third of the pantries in our neighborhood and across the city were closed. And I have seen it in the report, and it is true. But what happened, because where we are, there was a soup kitchen not far from us, and immediately the soup kitchen was closed. It took a while before they opened up. But in the meantime, what we were facing as an organization was a wraparound system. Thinking about what we have done during the pandemic, when you consider we were serving approximately, we were infusing about 3 million meals into the to food insecure families across the city in the Bronx, Queens, and Brooklyn. So we had practically 4 sites. But since the pandemic, as Chloe mentioned, we moved into a warehouse space because the need was so great. Now we have engaged 250 new partners that has never been engaged before. We have worked from ACS to homeless shelters, to NYCHA housing. And since March until now, we have addressed the need of over 320,000 families because of how we were able to strategize and immediately moved into a space that gave us the leverage we needed to make sure families were fed, and continued to push the PEBT, the SNAP that was needed, census that was important to our city. All those things was a combination. Some of the things that the report talked about, and I heard Charles mention it, we're not speaking. It's like you have a satellite system that's not speaking to the tower. And it's affecting not just pantries, but those that need to be served. That needs to change. Plentiful is working, but again, 1/3 of the pantries are actually accessing Plentiful. We had an opportunity before COVID-19. We were fortunate to set up a system that had online shopping. So after curbside distribution, we moved to online. Distribution was not easy because, as many of you know, there was a need to engage the taxi and limousine services, the dollar vans that were in the area, and volunteers. So the communication on the ground is poor. There's too many disconnect. And I found that duplication was a problem in everything we were doing. It is one thing that, let's say we dropped off 600 bags to families at one location this morning, and then somebody comes back this evening and drop off again. So the communication is needed in order for us to really address the disproportional needs in our community. That's, I think, would be one of the vital, and I've said this, I've echoed this 9 years ago and talked about, and I've said it more often, that pantries and City Harvest Food Bank needs to speak in sense of what are you doing hours. Years ago, I tried to form a network that would address making sure that we were not duplicating hours. We were not duplicating how we were distributing, but that we were really widespreading what we were doing so that families had access. It is a shame when one family says that I'm overrun with food and another says that I have not had any food at all. And so that's some of the things. But I applaud each and every one of you for the hard work you did on this report. It is worthy to be read. It's easily read, and that was important. It was factual, and it really addresses what exactly is happening in our city. And I'm hoping that it will be used to enhance, but also to secure food to those that need it the most.
Thank you so much for those comments. Before I open it back up to the broader group for some final questions before our question and answer, I did just want to ask Charmaine and Melony, are you guys seeing momentum as you're talking with broader stakeholders now, you know, coming out of some of the darker days, the pandemic? Obviously we're getting back into the fall and winter, but is there hope? Are you feeling hope these days?
I believe there is hope. I believe that the awareness is there. I strongly believe that those stakeholders are are aligning to the need. I'm finding it a little easier. There are some things that we are putting in place. The Campaign Against Hunger is putting in place that we believe that will make a radical change in Brooklyn that we are presently working on. And it was easy for me to express or to, I don't want to say sell the idea, but it was, the concept was embraced. So what we're finding is that our policymakers are listening, which I applaud them well. they're listening, they understand, they've seen that hunger is real. They are actually participating in helping us in getting the word out and getting the food out. So before it's like pulling teeth. Now it seemed like, okay, we know this is happening in our community. How can we help? So that's important. Stakeholders are coming alongside, calling and asking, what can we do? What additional, what do you need as an organization? And those things really encourage our team, our workers to go further. And volunteerism is getting easier in the food industry for us.
That's good to know. Great. Well,
can I just, so call me the cynic. Melony, I so appreciate your hopefulness. The Bronx is 62 out of all the 62 counties in New York State. The Bronx is ranked 62 out of 62 in health outcomes, right? A group of us formed a campaign, Not 62, the Campaign for a Healthy Bronx, about 5 years ago when we saw that Robert Wood Johnson report. And we have been advocating for the decision makers, both in New York City and in New York State, to address the fundamentals, to address the factors behind that very poor health outcome. That 62 ranking should have prepared many for the fact that the Bronx was the epicenter when New York City was the epicenter of COVID-19. I believe that any change that will happen because of a grassroots movement that will not tolerate business as usual. One of the concerns I've heard both locally and across communities across the country is the fear that the momentum will disappear, that all that we're hearing about, that COVID-19 has revealed the disparities, that this momentum will be lost and people will go back to marginalizing those communities. So any hope I have resides in the people like Melony and others who are unhesitating and untiring champions that will not allow policymakers and the decision makers to step away from this, that will seek to constantly put it in front of them, because our elected officials, they're elected officials because they're politicians, and it's what's either on their immediate radar as resonating with them, and unless they hear from their constituents again and again and again, and unless their constituents hold their feet to the fire, that is my source of hope. Because even such a, what I consider a landmark report, my fear is that it will get lost. Just as how my voice got lost a while ago with that low-flying airplane. But we have got to make it that this is not a one-time thing, that we're constantly at them, that we met with the mayor in December after trying to get a meeting with the mayor for almost 2 years, the Not 62 campaign, Bronx Health Reaches, arm of the Not 62 campaign. And we said to the mayor that if the Bronx is going to have any chance of not being 62, then it basically requires a Marshall Plan that is reflected in the budget of the city, that's reflected in the policies that we see in the city, and that is reflected in all the city agencies really showing that it has become a priority. So that's where my hope lies, if I have any hope at all.
I can just respond for a minute to that. Thank you so much, Charmaine. And we've talked about Not at 62 before. And I think my lesson for hope as a public health researcher is that the history of public health improvements has been precisely when communities and groups mobilize to put pressure on public officials and businesses to make a fairer, more equitable society. And the reason I share both your fears and Melony's hopes is I think that the pandemic creates the potential for new kinds of alliances that include food workers, healthcare workers, schools, teachers, parents, eaters, and that together we have the potential to create a new force that will insist we're not going back. We're going to build back better.
I agree. And Charmaine, I do understand and I hear your voice. And what we have to do is exactly what Nick says, is hold them accountable. Don't let go. Stay in their faces. And that's what we have to do. We have to work together as a team to make sure that they understand that we just what we experienced for the last 6 months, we do not need a repeat. We saw Sandy. After the dust was settled, everybody went back and we all forgot about what was going on. The thing is, the campaign against hunger stayed on the ground where it went, where Sandy was concerned, and it showed that we made a difference. What I'm saying now is, and echoing Nick again, is that it is time for us to raise up, but not to put down arms now. This report will strengthen what we have to do. It will bring reality to the truth. It is the truth. The documentation is valid. It is well researched. It deals with not just pantry, but just the overall look at New York City where food is concerned, food insecurity and restaurants and workers. It is time for us to put this on the agenda. And like you said, on the budget, we know we have quite a few funding sources concerning like EFAP and TFAP and the food bank and City Harvest. But there has to be a place in the policymakers' mind and heart and in their pens that they must address hunger and where we are. What I've noticed have come out of all this, there's a lot of pantries or pop-up pantries that wants to remain pantry. And so the city is going to be saturated with a lot of churches that are coming on as pantries, want to be pantries. The 250, most of those that we are supporting right now have never distributed food. And now we have to look at how will that fit into the equation? You know, how do we work with that? Food banks are not taking on new membership right away, and neither City Harvest. So here we have areas that are not being served, and we have individuals that want to help, but we have to look further down the road. How do we address this?
Mm-hmm.
I have one. Charlie, did you want to say something, or
No.
I had one quick comment along those lines of what Nick and Melony were talking about, and it's that now that Catherine Garcia is resigning, or I think the day is today, her official day. I'm not sure, but it concerns me. It concerned me before she even acknowledged that she was going to resign. It concerned me that once the pressure was lifted, what was considered pressure, I think this pressure is still there more than ever, that all of a sudden Kate would not be officially demoted, but her power would be taken away. This was my fear, as amongst others, and that the ability to cross-cut and to take charge and connect different agencies would be completely, put down. And Catherine Garcia would leave, and now she's definitely leaving. And Kate would not have the mayor's ear. And again, I have no knowledge of this, but I have this feeling like that Catherine Garcia had the mayor's cell phone number and could text him at any time. I'm making this up, by the way, but that's the feeling that I had. And now that, and I'm sure Kate doesn't have that. So my fear is that this is going to go back unless we do something. Promoting this report, having voices be heard, and things like that. So just wanted to put that out there.
Right.
Yeah.
And Charles, I also want to add, I know we are going to transition into a new mayor soon. We also want to look at that as a part of their platform. We want to bring that to their attention and see where they are and their stand on it and hold them accountable going into office.
And I think we have a lot that we can, because we went through this, we have a lot that we can do to say the next new mayor has to put food policy at the forefront. And as we said at the beginning, is has to elevate the Office of Food Policy and elevate Kate so that she does have that. I don't know Charles either, but so that she does have that. And I think the bigger thing to look at is many countries around the globe see basic food and people being not just fed, but well fed as a human right. And in the United States, we haven't seen that. And I think what we are doing is starting to say, we want to change. We want to see that food is a basic human right. And it is the function of government to make sure that everyone has food. And we just all need to keep elevating that, elevating the work that is doing that to show that it's happening so that we can continue.
Completely agree. I mean, at least for the moment, the pandemic seems to be in a stable place in New York City right now. But as we've been talking about, food insecurity remains at such a high. As we're talking about this, what are some other key strategies that you want the next mayor or New York City to continue to take on to alleviate food insecurity?
So just I know we're running short on time, but just to backtrack just for 1 second about some of the findings that we had on food pantries. That they were disproportionately, I want to reiterate this, they were disproportionately closed in underserved communities. And I think that that's, really important to note. And it's great that there are food pantries that are popping up. But again, we saw and we heard that food pantries couldn't get food. And that I just thought it was the weirdest thing I've ever seen when I was helping a food pantry try to get food, and Food Bank of New York and City Harvest was like, I'm sorry, we're not taking on any new pantries. It boggled my mind, and maybe Nick and Pam and you guys have heard something like that before, but
oh yeah, that's true.
I couldn't believe it was even possible. Like, this is not like Kmart or Target or, where you, oh, sorry, we're out of supplies. I just couldn't believe what I was hearing. So, the other thing, so the lack of food supply was really important. One of the reasons why they were closing. It was also because there were staffing problems, increased by by COVID, and many of the volunteers are older workers. So that was another reason why some pantries were closing, and some got sick. So I think all those were important. I just wanted to run through it'll take about 30 seconds, some of the findings that we had in our study with the 3 centers. That many minority communities described a fear of going outside and being vulnerable to catching the virus, especially if they or a member of their household had medical conditions. 2, those in need experienced long wait times. And I don't remember talking about this, but long wait times at food pantries, soup kitchens, and grocery stores, which were experiencing shortages and outages of food supply. And as one member described, and this is from our research, I had to be standing on a Tuesday and it was pouring rain and there were storms, and that's how we had to wait. It didn't matter because we needed food. Many were waiting with their kids. You weren't allowed to bring in kids. These issues are all in the report, and certainly important to discuss. Additional barrier was a limited number of days the pantries were open. In some instances, it was only once a week, or in some once a month. ID requirements for many food pantries and soup kitchens deterred undocumented individuals and families. Regarding SNAP, one interviewee that we from our report said, I'm afraid because maybe they'll take away our visa. This is why I have not asked for help from anyone. Many food pantries and soup kitchens experienced widespread food shortages, which we discussed, but there were donations from individuals and neighborhood businesses, which was great, but again, not coordinated. It was ad hoc. And smaller grocers and bodegas were utilized as an alternative to supermarkets, but participants had to pay more for their food, and they had to buy packaged and processed foods rather than fresh and perishable. And as Pam noted and Nick noted, diet quality is critical. This was kind of left by the wayside. So And city meals, again, not a criticism, but from our research, were repetitive and didn't offer a choice, and were served sometimes inconvenient and inconsistent locations. So anyway, I just wanted to put that out there from the report so that we all heard and saw that information.
Gratitude from that, I think we can learn from for sure. I mean, there are so many lessons there from a policy perspective that I think are key takeaways. I want to just let everyone know that you guys have been posting some amazing questions and answers, questions in the chat, and we're going to start going through some of them. But just to keep posting them for the remainder of the time. Just to start off, Isabella Harold asks, what are some ways that we can get involved and support food policy initiatives in New York City during COVID and beyond?
Well, one starting point is the New York City Council is working on a 10-year food plan for New York City, an important step forward to set specific goals and monitor our progress towards them. And all of us can be encouraging the City Council and the Mayor's office to develop that plan and to fully engage communities in coming up with goals that address the deep problems of our food system that we've talked about today: inequality, systemic racism, the conditions of food workers. So getting involved in our political system and insisting that as eaters and as residents of New York City, we have a right to participate in making the decisions that will determine what food is available in our communities.
And I would say contact the mayor's office, even though we're going to transition mayor soon, as well as your city council member, and tell them the importance of the Office of Food Policy and that needs to be codified so it is permanent and expanded and given the resources to plan. Our food policy office only has, the most it's ever had is 3 full-time people. Cities much, much, much smaller than New York have food policy offices with 4, 5, 6 full-time people. And so we need that office that can be the coordinating effort. And the more that all of our politicians hear that from all of you and everyone, the more that we can make that happen. And I think that can be the unifying place where everything we're talking about can stem from and happen.
Yeah, I think that's really important. And also reading our report, which should be available, late this week, maybe Saturday. But you can go to NY
Food 2020.
There we go. See,
and also the websites of any of our 3 organizations.
Yeah,
it'll be plastered everywhere. We're going to spread this high and wide for sure.
And
one other point to
We'd like to put that link
about what people can do. I think every organization in this city, the school system, I've been working for a long time on food insecurity at CUNY, where the rates of food insecurity doubled among CUNY students after the pandemic. Workplaces, the public housing, NYCHA, every one of those organizations can put pressure on the leaders of those organizations to address food insecurity, to address diet quality. And when there are people around the city and every organization saying, we want healthy food, we want to be assured that the food we have will maintain our health and will be affordable, then all these organizations that are an important part of our food system will be able to up their games in taking on that role.
So we've gotten a lot of questions about the quality of the food that's being served by agencies, and also cultural appropriateness of the food that's being served by agencies. So can we talk about that? What are the best policies to be advocating for? And maybe even backtrack, can someone explain to us a bit more about really what happened there and what we can learn from the past few months?
So I'm just going to mention something quickly, Pam, and then I'll let you take it over. I just wanted to say that, again, there was a Herculean effort, as we described, by the city to get things out there. And I've been asked about, there airlines were donating food and they were being distributed throughout the country and even in New York City. And they were delivering, boxes of, 9 meals at a time, some of them just shelf stable stuff, and Some of them were snacks. And I say this often, that if politicians and government staffers are checking a box saying people are fed, and that's the end of the story, that's the problem. If it's the checkbox and we're done, then that's a problem. If it's an interim fix and they know it and aware of it, then that's very, very different than checking the box and saying, hey, let's move on to the other areas of crises. Right. So, and I think that's a critical component. Sorry, Pam,
No, that's okay. That was a great, and I want to say again, the city and all of the emergency food providers and everyone, the effort was absolutely outstanding. And so we don't want to downplay that. And because basically, I think maybe the biggest thing to say, and I know a few panelists have said this before, is we have a food supply now that is not good. 60% of calories in the United States food supply are from ultra processed foods. And so we were starting from a place of what was available weren't the right foods to serve us well. So to say what I said before again is, if you look at the basic nutrition standard, all of the meals served through the Office of Food and Nutrition Services met the federal policies as well as the New York City standards. And the year before the pandemic, in the 2018-19 school year, New York City Office of Food and Nutrition Services did a pilot to do scratch cooked meals that was in 2 kitchens. And we were very fortunate to get to evaluate that. And that is what we need. And we can't let that go, because we are going to need agency meals to get people fed. We are going to need what is the emergency food system that's not for emergencies to keep people well fed. So we need to go all the way back through the food system and change that to look at diet quality. And so that the meals, we can say we weren't just proud of the fact that we worked on getting as many people as we could fed, but we got them fed well, and that we were using culturally appropriate food. So there was a lack of a variety in a lot of the meals. There was a lack of cultural appropriateness, even though the vegetarian, kosher, and halal meals were available from school food. So we need to look at that. And New York City can't do that alone. If we have a food supply that is challenged, and that's where we're getting food from, that's where we have to be looking at as well. And that's why we also need unified efforts for anti-hunger and nutrition policies at the state and the federal level as well, because it's all intertwined. New York City is part of the country, is part of the global system.
If I can mention one more
then I want to
initiative there, and then I'll give it back to you, Charles. Sorry.
Yeah, sorry.
There's a national program called the Good Food Purchasing Program. And around the country, in the United States, government spends tens of billions of dollars a year. Here in New York City, we probably spend something like $2 billion a year in buying food to serve in schools, hospitals, jails, childcare centers, senior centers. And the Good Food Purchasing Program is working to get cities and states and counties to sign on to an agreement to use that money to advance a variety of things. And there are 5 goals of the Good Food Purchasing Program. One is around health, having the food be healthier. A second is around environment, making sure that foods are grown in sustainable ways. A third is around labor, to make sure that the people who produce the food that's served in schools and hospitals and jails are well paid and have safe working conditions. The fourth is animal welfare, that the animals that are served are treated properly. And finally, that the purchases of food for city agencies is done to grow the local economy. And New York is working with the Good Food Purchasing Program, but another action that listeners can take is to encourage the city council and the mayor to fully embrace these values of the Good Food Purchasing Program, as Los Angeles has done, as Chicago has done, as Boston has done, as Washington has done, but not yet New York City. So that's a step we could take forward, and the COVID pandemic is one more reason to do that.
Yeah, and along those lines, and I agree, that's a great, and I even like the concept of calling it a good food program, because when you mentioned, and this is what I wanted to say, is when you mentioned standards, it makes me slightly uncomfortable, because it's great that there are standards, but what makes me a little uncomfortable is they're like bottom standards, right? Minimums. And just because someone's poor doesn't mean that they should have poor food, right? And I think that we've all talked about that. And I just want to put that out there, that it's important that there's fresh fruits and vegetables, and all these kinds of things are distributed, by the city in these programs. And there was an attempt, and I think that they were trying to do some of those things. And one of the things that we found in our report was that they did hire many, many vendors, which again, the Food SAR and Kate McKenzie and all that whole team really worked hard. They put out RFPs to catering companies and restaurants. So there was an attempt to have high quality foods. They were spending between $8 and $10 from what I understand. Again, I don't have the facts in front of me, but I think those were all good steps of high quality food, not just meeting those standards. And that's along the lines of what you were talking about, Nick, of a good food program with those kinds of standards as well.
Okay, so another really great question. Letitia Santana asks, it is my understanding schools are looking to increase fresh farm products into their menus by 30% within the next 2 years. How can we use the current data to assist farms to collaborate with DOE?
So yes, that is great, and that is actually a state level plan, and the state would actually raise the amount that they put towards school meals if schools can actually get up to that 30%. The challenge is that we need to, as the questioner said, is how do we support local farms to make sure that there is enough? Because if we wanted all New York State school systems to get 30% of their food from New York State, we're not producing that not much right now, and the channels to get it to schools don't exist. So that is again why we need strong government and strong government systems to create those systems in place. And I think that fits exactly in. I'm so glad that Nick brought up the good food purchasing, because that's part of the local economies, and setting that up and setting up a system where there is more of a regional reliance on food, and a regional system that can supply food would fit the good food purchasing, would fit that local food, as well as some things that actually would go into the kitchen. There's actually, what we found with the scratch cooking pilot is to do full scratch cooking would take a huge infrastructure investment into kitchens, yet there are ways that there can be more scratch cooking and what's called scratch food service that is basically using some scratch techniques with minimal investment into the kitchens. And so making that a priority and having that happen as well, I think can go a really long way.
Okay, so we're gonna do one more question. So this is a longer term one, which is perfect to end on for this question and answer. How are emergency food organizations like pantries moving from food security to food sovereignty, knowing that their efforts are not long-term solutions?
I wonder if Melony or Charmaine, you have thoughts on that.
Right. But the premise of that is somewhat off, because as I mentioned earlier, in communities like the South Bronx, the food pantries are the primary source of food access for many. It's not as it was originally thought of as meeting emergency food needs, a sudden loss of a job for whatever reason or that sort of thing. For many in the Bronx, which has the poorest urban congressional district, not in the state, but in the country, the food pantries are how they are able to feed themselves and their family, which speaks to something that the report indicated, and I just want to make sure it got highlighted before we finished. When it said that the fundamental causes of food insecurity is the persistent poverty and the growing income inequality. There was also a wonderful point made in the report that says, while the charity organizations have addressed food insecurity for hundreds of thousands of New Yorkers, what they've not done is reduce the scope of the problem or advance the vision of a hunger-free city. And actually, I wanted to say to the authors that that may have been could be misconstrued as that is the work of charity organizations. I don't think that's the point you were making. But charity organizations should not be advancing a vision of a hunger-free society. They're there to meet an emergency need. And so I remember one of the real concerns I had in the Bloomberg administration when there was this push to really encourage less soda consumption, and there was the idea of shrinking the cup size and all of that. While on the other hand, there was a contradictory movement of not supporting a living wage. Hey, when you are that poor, for parts of the Bronx, particularly in the South Bronx, where about 29% live below the federal poverty level, where the unemployment rate now in the pandemic is over 20%. You cannot talk about improving access to food and making food pantries what they were intended to be, emergency sources for food, unless you're talking about how you get people out of poverty, how you get it so that the Bronx is not a fertile environment, which it currently is, and other places in New York, for fast food. Hey, you don't go into more affluent communities and see McDonald's promoting a $1 menu. You do not. You know why it's fertile ground for the Bronx? Because a family of 4, think about it, can provide dinner for $4 if each person gets a $1 burger. So when we're talking about transitioning food pantries and those things, we have to peel it back. We have to uncover what are the fundamentals that keep people so tightly connected to food pantries. If they don't have the money, they do the best that they can. And food pantries right now, in the current impoverished conditions that so many live in, that's their only recourse.
Thank you so much for that. I've got so much in my head that I'm thinking about it. So many of us will be having so much that we're going to be thinking about for the rest of the week and way beyond. So just to wrap up, last question. What are your main conclusions really about the impact and effectiveness of the city's response to the food dimensions of the pandemic to date? I know it's going to leave us with a lot of lasting thoughts more.
So I think my white hair earned me the right to get the last word. And I first wanted to say I so appreciated comments from Charmaine and Melony about the effort to be timely in this report. You know, we're academics, and often we take a year or 2 years to do a report, and it's out of date. We felt strongly that we wanted to have something out before the end of September. So we made that goal. But we also realized we left many things out, and we really want to invite all of you. We hope to be doing another report by the end of the year and another in 2021, that you send us questions, suggestions, information, criticisms of the report after you've read it, and we really look forward to that. We think New York City has worked heroically to address the gaps in food availability triggered by COVID. It has launched one of the largest emergency feeding programs in the nation's history and has brought together city agencies, nonprofits, and community groups to work together to meet people's food needs. But I'm left with 3 overriding concerns that I hope we can commit to working together on. First, the pandemic offers New York City the opportunity to get real on ending food insecurity. Charity, as many of us have said, is an important but not a lasting solution. And I worry that in responding to the pandemic, that the city is reinforcing its charitable food system rather than building a system that can end food insecurity. We need to pay attention to that. Second, the city needs to do more to address the working conditions of food workers. We need a comprehensive plan, both for the next stage of the pandemic, and I fear it could get worse before it gets better, and beyond, to improve the conditions of food workers. One model is the dramatic improvements in pay and working conditions for healthcare workers in New York City in the 1960s, brought about by unionization of that workforce, stronger regulation, and public programs to subsidize healthcare. What would that mean for food? And finally, we need to reject the idea that austerity is the inevitable solution to economic hard times. I came of age as a public health professional during the city's 1975 fiscal crisis, and I saw the consequences of deep cuts in spending on healthcare, education, housing, and other services. These cuts played an important role in triggering epidemics of homicide, drug use, tuberculosis, and HIV infection in the following decade. And it cost tens of billions of dollars more to address those epidemics than the few $billion that the city saved during those budget cuts. Then and now, the solution is a fair allocation of taxes so that the very wealthy pay their fair share for the city services that they depend on to get their workforce ready and able to work. We need to make sure that in their squabbling over budgets, our elected officials at all three levels don't make decisions that plant the seeds for 2, 3, and many future epidemics. As health professionals, students, parents, concerned citizens, and food justice advocates, we need to insist that another world is possible than the one we're living in today. And thank you all so much for joining us today.
Thank you, Nick, and thanks, everyone.
Yes, thank you. And remain hopeful. I think that was one of our key messages.
Healthy and helpful.
Thank you for
Thank
this
you.
really thoughtful, thought-provoking report.
Thank you for the opportunity. And I know based on this report, we're going to move another step into the right direction.
Mm-hmm.
We all have a lot of actionable things to take with us into the election and beyond.
Yeah.
Thank you.
I'm ending it now.